Hi, everyone. We're here today. It's Tripod Thursdays. Today we have on Sabrina Teles and Sofia Mirzazada. They're both our occupational therapists that we have here at the Tripod Clinic, and we're excited to have them on today. We're going to talk about a lot of things to do with OT, their services, a patient story, and how to contact them for an appointment. Welcome, ladies.
Thank you for having us.
Yes, thank you so much.
No, we're so glad you could come on. I know you are quite busy, so thank you. So we have a few questions today that the ladies are going to answer just to clarify kind of their services and so forth. So the first question we have is what is occupational therapy and how does it relate to fertility? Sophia?
So, occupational therapy is a person-centered health profession focused on promoting health and well-being through everyday activities. The primary goal of occupational therapy, or OT, is an abbreviation we like to use, is to enable people to participate in meaningful activities, routines, and roles. And these kind of activities that are a part of our day-to-day lives, we like to label them occupations, which is where the occupation part comes from occupational therapy. So OTs work with people to enhance their ability to engage in the occupations they want to do, need to do, or are expected to do. And we achieve this outcome by modifying the activity, the environment to better support overall engagement. So our services often focus on promoting self-management strategies by creating or providing wellness goals, interventions, and recommendations. In terms of how OT relates to fertility, we know that fertility challenges can be an emotionally taxing and stressful process for individuals and their loved ones. Research on fertility challenges highlights its significant impact on physical and psychological well-being, so including feelings of anger, guilt, avoidance, grief, and even effects on self-esteem, relationships, and financial security. But fertility challenges are also met with changes to one's daily life, identity, roles, and routines. And so it kind of reduces that overall engagement that people like to do in their everyday lives. And this is where kind of OT can come in, or occupational therapy can come in, and it really shows the value that we can provide in supporting the care and well-being of fertility clients at Tripod Fertility. We also, as our kind of philosophy or motto, we really want to emphasize more of a prevention strategy versus more reactive or reaction. And what we mean by that is that we like to meet with fertility clients early on in their journey as much as we can to provide them with those strategies to help them prepare when they go through those intensive fertility services, and they can have a plan in place. So it's more preventative than reactive. And that's the philosophy that we hope to follow and have been following so far.
Okay, great. Thank you for that. What
No
is the
problem.
difference between OT and other mental health services?
So OTs are different from other mental health care providers. So, for example, psychotherapists, social workers, or counselors, as we have a bit of a more holistic lens, focused on helping an individual develop skills and strategies to get back to managing their daily activities and being able to engage in those activities that they find meaningful. So, yes, we do kind of follow similar psychotherapy approaches. So, for example, cognitive behavioral therapy, dialectical behavior therapy, acceptance and commitment therapy, a lot of different therapies that other mental health care providers also follow, but we like to tailor it a little bit more towards the individual, but also bringing in those important occupations that very much is meaningful to them in their everyday lives. And OTs are actually one of 5 regulated health professions that are able to practice the controlled act of psychotherapy in Ontario as well. So we are able to provide that psychotherapy or psychological well-being support to fertility patients.
Okay. And so what types of OT services are offered for fertility patients?
We have an array of services that we provide, but we've tried to condense them into a little list that we have. But again, it really depends on the challenges or what the fertility patients would like to work on with us. But usually, it involves stress and anxiety management, especially when you're going through this process. You're trying to prepare yourself, you're trying to digest all the different kind of changes that are happening in your life when it comes to going through fertility, through your fertility journey. So we provide stress and anxiety management. We also provide counseling services. So this can involve emotional support, coping techniques, and even discussing your relationships in your life as well that may have been affected because of the fertility challenges that patients go through. And we offer both one-to-one and couples sessions as well when it comes to counseling. We also provide the service called establishing, adapting, and planning your daily routines. So this can look at creating goals and a personalized plan or routine that works for fertility clients and tries to adapt with what they're going through in that kind of moment of their fertility journey. We also look at sleep hygiene and sleep habits, as that's something that can be disrupted during your fertility journey, or just even in general. It's always helpful to know some strategies that can support your quality of sleep and improving that. We also look at fatigue and energy management. So looking at, your energy levels throughout the day, how you can best maximize, looking into strategies that can support your ability to engage in those activities that you'd like to do, but are often limited because of fatigue or limited energy as well. We also offer physical symptom and pain management services as well. And this can often be, due to pre-existing conditions that patients might have, or even that kind of are brought on through the medications that they're taking, or even just the physical toll from the fertility treatments that they're undergoing. We also look at ergonomics and posture support, as well as equipment recommendations and home adaptations. Yes, this was a long list, but we do provide a lot more services as well, depending on what patients would like to work on.
Yeah, thank you for that overview. A lot of patients may not know all the services that you provide, so it's great that you went over. You said several, and there is more in the sense of what you can offer.
For sure.
Yeah. So Sabrina, is there any way you could give us an example of how a patient was able to utilize your services? Take note of your techniques and strategies and the outcome?
Yeah, for sure. So I'll give you a brief example. So we had a client that was referred to our services by one of the clinic physicians. They referred to them for, high levels of stress and anxiety that they were experiencing through ongoing fertility challenges. And this was after their initial consult with the physician. So they reached out to us and said, please follow up with this client. So we reached out to the client and said, we have a referral for you for OT services. We'd like to connect with you. And we developed, a way to engage in developing that with the client. And we booked a 15-minute consult with the client. And during that session, the client identified that they were experienced some disruptions in their daily routine. So they were unable to function in their day-to-day work tasks at their, job and also at home, some struggles in their relationships, and also some difficulty with their sleep patterns and experiencing some insomnia-like symptoms. So we had worked together to create an individualized care plan. And we briefly spoke to that in our 15-minute consult. But once we booked our formal one-hour session, we were able to go through the goals that the client really wanted to work towards. And all of those goals work towards the larger goal of reducing their stress and anxiety. And, our OT sessions focus on addressing those stress and anxiety through emotional regulation, through reframing their negative thinking and negative thoughts. And then once we're able to kind of work through some of that, we were able to transition towards tangible coping strategies and wellness strategies that focus on a variety of things, but some of which included breathing techniques, grounding techniques, and things that they were really able to use in their day-to-day when they were feeling a sense of overwhelm or stress, regardless of what was happening in their day. And throughout our sessions together, we were able to use a combination of both standardized and non-standardized assessments, meaning standardized being that they were, formal and had like a numerical value associated with it, and then non-standardized just meaning really checking in with how the client was feeling from our session to session check-ins. And by doing that over a 2-month span, we were really able to see that the client demonstrated improvements in their wellness, and their stress and anxiety levels significantly decreased. And that was not only supported by the standardized assessments that we did and seeing the numerical value decrease from the initial, session that we engaged in and a few sessions later, but also in how they felt and how they reported and, realizing that, I really feel better. I feel better prepared to, start my fertility treatments. And I feel like I'm in a better place physically, emotionally, mentally, and really feeling that they're able to take on whatever it is that they have to take on next. And another thing that really, stood out to us when we're engaging with this client was that they shared that they really benefited from engaging with our in-clinic services. And they had previously, sought out other mental health services from an external, source, but realized, having that in-clinic therapist available were really allowing them to not only have access to us a bit more readily, but that we were able to be aware of their fertility treatments and kind of had that up-to-date knowledge on what was going on, and that we were really able to provide them with that timely care that they required, and really benefited from that prior to engaging in their fertility treatments and then throughout the process as well.
That's a great story. Thank you for sharing that.
Of course.
So what is the cost of an OT session and what's covered? Is it covered?
Yeah. Yeah, so the rate that we have at the clinic is $60 per 30-minute one-to-one session. And most clients tend to book a 1-hour session, so that would amount to $120. But it really depends on what works for you in your schedule and with what you prefer. And the best part about OT services are that many insurance companies do cover our services, and the clinic does offer direct billing. So it's a really convenient and easy process that you can engage in and get the sessions underway.
Okay, great. So how do you, register for an appointment, and what does that process look like?
Yeah, so as I mentioned a bit before in the client story, that they were or to our services in the clinic by the physician, but you can also self-refer. So if you find that, you haven't been formally referred by a physician or a nurse, you're able to self-refer yourself either by going onto our website and downloading the referral form, or even by asking the admin staff to kind of have that emailed to you. There's many different ways that you can access, getting referred to our services. And once, you are connected with us through that referral form, again, whether that's individually referring yourself or from the clinic staff, then we will reach out to you by email to connect with you to kind of clarify that you are interested in these services and setting up that 15-minute consult. And once we set up that free 15-minute consult that typically is done virtually, so it's an easy way to connect early on, then we're able to, kind of plan how the next steps will look. And once we, decide if OT is a really good fit for you and that you're able to see yourself progressing through our services, then we'll follow up and schedule that 30-minute or 1-hour session, either virtually or in person. We do offer in-person sessions. Again, it really depends on what works best for the client and their schedule, and what works best for them. And then that also speaks to the fact that, once we start our therapy sessions, it really is up to the client how frequent they'd like to meet with us and for how long. So whether that is 30 minutes or that is the 1-hour time slot. And if that means it's once a week, bi-weekly, or even once a month, whatever really works best for them is what we really emphasize, as we want, clients to feel that this is, their wellness journey and this is their fertility journey. And we're here to support them along the way.
Yes, thank you for that. Depending on what they prefer, they can fill out the form online and then speak to you directly and go over the areas of
exactly
most desire to speak about. Perfect. Okay, well, thank you so much for coming on. We definitely appreciate both of you, answering these questions and going over the process to book an appointment. Great.
Of course. Thank you so much for having us.
Thank you
Yes,
so much.
thank you. Thank you for this opportunity. Thank you.